Good afternoon, everyone. This is Dr. Bhupesh from drbkmoet Institutes, welcoming you for another lecture. And obviously, we will discuss reading, listening, and everything. But today, we are going to discuss the writing first, then we will do a bit of reading and maybe followed by listening. So, today, I'm just going to cover the basics of OET letter writing so that you can understand what it is all about. See, that is what we are talking when it comes to OET. You all have to understand when it comes to OET. OET means that we are basically the nurses or the doctors, and we are writing the letter to someone. Suppose if we are writing the letter to a senior surgeon, so that means that basically we are referring the patient to senior surgeon. So that means it is a referral letter. Suppose if the patient was in this case, we were unable to treat the patient. That is why we needed a senior surgeon. Suppose if somebody was having pain, chest pain. If we were unable to treat it, so we sent him to cardiologist. We said, maybe sir, there is some doubt. So maybe the patient is suspected with angina. The patient is suspected with angina. So that becomes the primary reason, purpose of the letter, the first paragraph. So first paragraph is so much easy to write that you are not sure. So there was a chest pain. You are a nurse or you are a nurse at GP clinic. GP clinic means general doctor, means just MBBS doctor. GP means general practitioner, mean MBBS doctor in our country. So the patient was coming to you for the chest pain, but your doctor was unable to treat the patient. He gave some medication, the things did not work out. So you are the nurse at that GP clinic. You told the patient, you are writing a referral letter to the cardiologist that this patient is not getting better, sir. So we are sending him to you. We are sending him to you. So we will say, sir, if I have to write this letter, I will say this letter. Okay, I will write the complete first paragraph. This letter is being written regarding Mr. X, who is having chest pain. Suppose he is having chest pain from 2 weeks. Now, this is what is OET grammar. Whenever there is any continuous tense, when it comes with time, it becomes present perfect continuous. What does it mean? So you will change it to has been having chest pain for 2 weeks. So this becomes for rather than from, and is ring becomes has been ing. This gives you marks. OET says when somebody writes present perfect continuous has been ing with since or for, that means that person knows a level of grammar. That is how OET grades you. When you write these kind of tenses, they say this person knows a level of grammar, means 450 marks or related to grammar. So again, talking about the main thing, we were saying this letter is being written regarding Mr. X, who has been having chest pain. So what did your GP did? So you will say even after the required treatment, even after the treatment, or you even after the treatment becomes sorry. Even word is important. Even after giving medications. Now see, there has not been any improvement. This is the grammar, yaar. This is everything. So now you are a nurse at GP clinic. You say, sir, this patient has been having chest pain for 2 weeks. Even after giving medications, or if there is anything like maybe and advising rest, whatever is given. And even if by chance rest is given, you do not write it. It still does not change anything. So don't over panic when it comes to OET writing. So this letter is being written regarding Mr. X, who has been having chest pain for 2 weeks. Even after giving medication, there has not been much improvement or any improvement. Any improvement means no improvement. Much improvement means not enough. So that is again up to your English. So I say, okay, there hasn't been any improvement. Therefore, or, or you can say now, if it is given that patient is suspected with Now he is suspected with angina or angina pectoris, whatever it is. Whatever this would be given, don't worry about it. So now he's suspected, therefore, he is being referred under your expertise. I'm just giving an example. Medically, I don't know whether it is right or wrong that anybody can suffer from chest pain for 2 weeks or not. But yeah, considering being I am a dentist, but yeah, I have been teaching OET since last 11 years. But I can teach you the best grammar and the best things about OET. So this is how simple the letter is. You are writing to a cardio surgeon, sir, the patient, even this is the main line, even no, and this is the main purpose. This is the purpose. This line is important. This line is important. Please give 2 minutes. Don't be in rush if you want to learn. That is the best grammar I can teach you. If by chance, somebody writes like this, just for a second, this letter is being written regarding Mr. X, who is suspected with angina pectoris. Therefore, he is being referred under your expertise. Sorry. Even then, that person will get full marks because this is the main purpose. That is what you need to understand. This is the main thing. When you are confused about any letter in the exam, if the letter is tough, you are not understanding, then just find the main purpose. You will pass. This is the main purpose. When I write this thing, the way I wrote earlier, this is good because now in the first paragraph only, examiner will determine that you will pass because he can see your present perfect. He can know the sequence of the patient. That patient was coming for 2 weeks. Patient took medications. There was no improvement. Now he is suspected with this. That is why. Now he knows everything. This is our method, Dr. BKM's method. That is where people score more than 350 or 400. Again, I'm saying, even this is fine. No problem. Rather than writing wrong, it's better to write. So this is, you are referring the patient to cardiologist. So it is a referral letter. So that is why some people who do not know how to teach OET, they confuse you. This was a referral letter. This was a visit. Every letter is a visit letter. Every letter is a referral letter because you are referring the patient. Suppose, now take another example, second example of OET. Take it light, take it very light. Means you don't have to put pressure on yourself to learn OET. It's very easy. Second example, let's say. Now the patient was coming to your hospital. In the hospital, obviously, we have every kind of treatment. So obviously the patient condition will improve. So that means when the patient's condition improve, so why when see you are the nurses and NHS UK is inviting you. So that means there is scarcity of the nurses in the hospital. So when the condition of the patient improves, they do not like to keep the patient in the hospital. They do not like to ask the patient to come to hospital. So what they do, they refer the patient to GP or to the nurse. That is what happens in the foreign countries. When the patient is better, and what will GP or nurse do? Follow up care. It is also kind of a referral to a nurse. So each and every, this was a visit letter. Even then it was a referral letter. Even then it was a referral letter. Now also, even this is a referral letter. So don't confuse yourself. But only thing I can say about this letter, this was a visit letter because patient was coming to visit the GP clinic. And it is a hospitalization, during hospitalization wala letter because patient was hospitalized. Now say patient was hospitalized due to angina. So this letter is being written regarding Mr. X, who was admitted to our hospital due to myocardial infarction. Stents were placed. You wanted to know about grammar, sir? The best grammar is was were third form. Was were third form means passive voice. That means it was done by us. Us means hospital. We are the part of hospital being nurses or doctors. So stents were placed. Was were third form is the key. Who was admitted to our hospital? By us, by the hospital. So this letter is being written regarding Mr. X, who was admitted to our hospital due to MI, stents were placed, and required treatment was given. Again, this is all passive. Was were third form, and required treatment was given. What will happen after this? Now he is better. Now when patient will get better, what will you do? So he is being discharged. How simple. It is just normal nursing. You all know about it. You can't fail in OET. If you understand, you cannot fail, buddy. You cannot. Just stay and feel like a nurse. So patient is getting better, so he discharged. However, now the main purpose. Now the main purpose. That would be given again. However, sorry, spelling. However, he still needs follow-up care. So, or therefore, he is being referred to you. Even this in this line also, if you notice, we are using the word referred because we are referring to the nurse. And in this case, letter can be to the community nurse, to the district nurse. What is community nurse? Community nurse are the nurses who stay in the community health center. In foreign countries, we have got hospital. After hospital, patient goes to their respective community health center in their local areas to get the treatment from the community nurse who provides follow-up care. What is district nurse? District nurse is the nurse same like community nurse, but she does not stay in community center. She's kind of a follow-up care nurse who travels from one place to another. So there is no difference. Every letter is a referral letter. Yeah, don't get confused. In this, hospitalization was there, so we say it is a hospitalization one letter. In this, patient was coming to the GP for the visit clinic. That's why it's a visit. Third and the most important type of letter, the most repeated letter of OET. Referred back letter. Referred back letter. What is happening? Patient went to GP. GP could not treat the patient, so he sent the patient to senior doctor. Senior doctor treated the patient. All right. And the patient is better. So what will senior surgeon do? He will discharge the patient, hospitalization, after hospitalization, discharge. Now after discharge, who will provide the follow-up care? The same GP. Referred back means the story started with GP, senior doctor treated, patient better, then discharged, again coming back to GP. That is why we call it refer back, because it started with the GP and it came back to GP. So now how to write this letter? Simple, just follow the sequence. This letter is being written. Just follow the sequence, guys, being written. And grammar is so easy in OET regarding one of your referred patients. How easy are one of your referred patients? Mr. X, who was admitted to our hospital due to MI. Rest I can copy paste because rest of the things are happening in the same way. Copy, paste. I will also put it. So stents were placed. After admission, stents were placed, required treatment was given. Now is better, so he is being discharged. However, still he needs follow-up care. Therefore, he is being referred to you for the, or he is being referred to you. Now, again, this is good enough. You need not change it. But if you want to make little better, now he's being discharged. So he's being discharged. However, he still needs follow-up care. Now this is the word. It will make the letter wow. And being his GP. Being his GP means you are the GP of the patient. Being his GP, you are requested to provide him the follow-up care. The required care. I cannot write two times follow-up care. So follow-up care means the care that is required. So now see this wonderful letter. This letter is being written regarding one of your referred patients, Mr. X. ऐसा ही हुआ था. That was happening in this as well. Who was admitted to our hospital due to MI, stands for place, required treatment was given. Now he is better, so he is being discharged. However, still, and being his GP, you are requested to provide him the report. Perfect. These are the three most typical kinds of OET letter. And in this, every letter you are using a referred. In this, you cannot say referral, but you can say again you are referring the patient back to GP. That is why it is known as referred back letter. So please don't confuse yourself when I ask you what kind of exam came and you say, sir, it was a referral. Every letter is a referral letter because you are referring the patient to someone. You are referring the patient to someone. And that is the best part. See, in 20 minutes, you can cover the whole OET letters basics. This is how easy OET writing is. This is Dr. Bhupesh from Dr. BKM OET Institutes. Our contact number is 76967 34256. You may contact us for the best OET coaching. Thank you.